Good morning. My name is Michael Anhorn. I'm the Chief Executive Officer of the Canadian Mental Health Association, Toronto branch. And it's my privilege and honor to welcome you to our Roots Community Centre. As we get started, I want to acknowledge that we deliver services on the traditional land known as Takaranto, which means the place in the water where the trees stand. Takaranto is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wyandot peoples. And it continues to be home to many diverse First Nations, Inuit, and Métis peoples. We acknowledge that Takaranto is covered by Treaty 13, signed with the Mississaugas of the Credit, and the Williams Treaty, signed with multiple Mississaugas and Chippewa bands. We also acknowledge the Dish with One Spoon Treaty, an agreement to peaceably share and care for the Great Lakes region. It's my pleasure to welcome our esteemed guests, the Honourable Christine Elliott, Minister of Health, and the Honourable Michael Tibollo, Associate Minister of Mental Health and Addictions. And again, welcome to our Roots Community Centre. This centre would normally be bustling with people, shoulder to shoulder, all seeking support for their mental health. During the pandemic, obviously that has not been possible. But just because this centre is vacant, please don't let it fool you to think that we're not supporting people. Our staff have used an incredible level of creativity and innovation to continue to support people and meet their mental health needs throughout this pandemic. We know that this pandemic's impacted almost all of us in terms of our mental wellness. But people with mental illness have been impacted even more strongly than most of the rest of us. And so our staff have continued to ensure that that support is available, and having been declared an essential service through this pandemic, they've risen to that challenge to ensure people are supported throughout. It's times like this when we need to come together as a community to support our mental health, to support those living with mental illness to be as well as they can through the pandemic. And that's one of the reasons I'm so excited and so honored to have Minister Elliott and Associate Minister Tibollo for today's announcement. We're going to hear more from them about how the government is going to continue to support the mental health of Ontarians. And so it gives me great pleasure to welcome the Honourable Michael Tibollo to the podium. Associate Minister.
Thank you, Michael, and thank you, everyone, for joining us this morning. Since taking office as Ontario's first Associate Minister of Mental Health and Addictions, I've heard many stories of the struggles individuals and their families have been facing. Mental health and addictions issues have taken a toll on so many lives and the lives of their loved ones. I have my own experience of the time working in the mental health and addiction sector, where I helped those struggling with their mental health and their use of substances. I cannot begin to tell you how many times I've had to talk to the broken, desperate families left behind wondering where they went wrong. To make matters worse, the COVID-19 outbreak has greatly impacted the mental health of many Ontarians. The social isolation, the uncertainty of the future, and the financial uncertainty so many are experiencing, all of it creates added pressure that can be difficult for people and families to handle. Yet we know that when people have the right supports, they can recover and help can be effective. Right now, we're in a marathon race, and like a marathon race, our endurance, consistency, and sustained engagement are all being tested. And like a marathon, our success or failure will depend on what we do and how we can maintain our mental strength to persevere through these most difficult times. And that's why I'm pleased today to announce that our government is investing over $147 million to immediately expand access to critical mental health and addiction services for Ontarians of all ages during this COVID-19 outbreak. During this critical moment in our fight against COVID-19, this investment will help to alleviate capacity pressures experienced throughout Ontario's mental health and addiction system. This investment will see over $60 million invested in community-based mental health and addiction services and interprofessional primary care teams. This will include $30 million in targeted funding for children and youth mental health services. And we're also investing $8 million in targeted culturally safe services for Indigenous peoples, and over $10 million to help specific vulnerable populations, such as those in residential settings that may be at high risk of COVID-19 outbreaks, those at risk of homelessness, social isolation, and individuals in the justice system. Finally, this investment includes over $15 million to expand virtual mental health and addiction supports, making it easier for Ontarians across the province to access these resources. And this will include internet-based cognitive behavioral therapy and virtual supports for healthcare workers. Our government recognizes that more needs to be done to ensure that people and families are fully supported during these very difficult times. And that's why we're taking real action to expand easily accessible mental health and addictions care during the COVID-19 outbreak and ensure that people and families across the province don't have to struggle on their own. To every person in Ontario, I want to remind you that it's okay to not be okay. Help is available. If you need to talk, we're here for you. I'd now like to invite Minister Elliott to say a few words. Thank you.
Thank you very much, Minister Tibollo, and good morning, everyone. Throughout the pandemic, our government has made the health and well-being of Ontarians our top priority. We have also firmly maintained that mental health is health. The impacts of the COVID-19 pandemic have been challenging for many individuals and families across Ontario, especially among those living with mental health and/or addictions challenges. Prolonged physical distancing, financial uncertainty, and constantly being inundated with new information about the virus can take its toll on our mental health. And being isolated during the holiday season can be especially difficult. With the holiday season just around the corner, the investments we are announcing today will address the increasing demand for services during these very difficult times. With Ontario in a second wave of COVID-19, it's critical that we act now to ensure that mental health and addiction supports are in place for those in our population who need them. By supporting our most vulnerable populations while also expanding community-based virtual and online supports, we are ensuring that the right mental health and addiction services are available to those who need them when and where they need them. Our government has committed to investing $3.8 billion over 10 years with our Roadmap to Wellness to expand existing programs and to fill in the gaps with innovative solutions. Our government has always maintained that creating a system of mental health and addiction supports that Ontarians can rely on will take time. But by working together, and it will take all of us together, we are creating a system that is going to work for all Ontarians. So thank you.
We'll now move on to questions from the media. Reminder, one question, one follow-up. Operator, first question, please.
Your first question comes from Lucas Meyer from News Talk 1010. Lucas, please go ahead.
Thank you very much. Appreciate it. Minister, on another subject, we learned today that the government is reversing what it originally said, which was that we would be getting a proof of vaccination. You were pretty firm about this when we spoke to you about it. Can you just go into why the reversal? I understand it may still be under consideration. Can you just go into that?
No, people will receive a confirmation of the vaccination when they receive the first dose. They will get a receipt indicating that they've had the first dose. When they get the second dose, they will receive confirmation. We're just finalizing the format it's going to take, But this is something that we've planned for all along, and we know that many people are going to need that confirmation for a whole variety of reasons, travel, work-related, and other reasons.
Follow-up, please.
Okay, so that's a little bit different from what you heard from the ministry. So just to be clear, what exactly then are they getting them now? It's some sort of receipt, and then will there be something a little bit more, I guess, formal down the road? Can you just be totally clear on that?
Yes, absolutely. People will receive a receipt when they receive the first dose, and then upon the second dose, when it's been completed, they will receive something more substantive. As I said, because many people are going to need it for lots of reasons.
Next question.
Your next question comes from Randy Rath from CHCH TV. Randy, please go ahead.
Hi, Randy.
Hi, ministers. Today, the Ontario Hospital Association are calling for immediate, stronger, and strictly enforced lockdowns in the hot zones in the province. Mr. Elliott, is this something that do you support that? And are you going to argue that in cabinet this week?
Well, we're very concerned with the increasing numbers of cases. The community spread of COVID-19 is a concern across the province, but of course, particularly in the hot zones where we really want to get the numbers down. And we know that it is affecting hospital capacity. Many hospitals are at full capacity now and have had to postpone once again the surgeries and procedures that were postponed during wave 1. So this is a concern for both COVID patients and making sure that hospitals have capacity to care for them, but also for those people who have been waiting for perhaps cancer surgery or cardiac surgery. We want to make sure that they can have access to them as well. So we are working with the Hospital Association. We are very aware of their concerns. We receive those numbers on a daily basis as well. And so we are looking at considerations, what's been working, what hasn't been working, because we want to make sure that we put in the most effective measures possible. But of course, I know that COVID fatigue has set in with many people. They may be thinking that because the vaccine is on the horizon now that they don't need to be as careful, but it's ever more important that people be careful now. Please continue to follow the public health measures that we've been talking about since the pandemic began, the physical distancing, the wearing a face covering if you can't do that, frequent hand washing, and staying home if you're not feeling well. That's the best way that we can reduce the community transmission until everyone has received a vaccine that wants one.
Follow-up.
Do you think that there should be a change in the parameters of the gray lockdown zone, I suppose you'd say, to make it more strict so that we don't have people clamoring into big box stores and that sort of thing?
Well, we have concerns as much about social get-togethers as anything else, especially as we're going into the holiday season. And that's why we're really asking people to please just celebrate the holidays with your immediate household. Please don't get together with large groups of friends and family. Again, that's the best way to reduce transmission. And we've already got pretty restricted numbers of people that can go into the big box stores and under very strict conditions. So all of them add up, but I would say right now, the most important thing as we head into the holidays is to please limit your social gatherings just to your own household. That's really important. That's something that all of us can do as members of the community to keep ourselves and our loved ones safe and healthy.
Last question.
Your next question comes from Laura Stone from the Globe and Mail. Laura, please go ahead.
Hi, Minister. On the topic of what the Ontario Hospital Association called for today, you said you're looking at consideration. So can you explain exactly what is your government considering? Are you considering locking down the Toronto area or even the province at this point, as the Hospital Association paints a very dire and troubling picture of what's going on? What is on the table?
Well, I know that the Hospital Association is very concerned about capacity. They want to be able to care for all patients that come in, whether they have COVID or other issues. And so, as the Premier has said many times, There's nothing off the table at this point. We're considering everything, the best ways to limit community spread. So I would say that nothing has been determined as yet. We're having discussions about that, but we want to make sure that we can keep all Ontarians safe and healthy over the holidays.
Follow-up?
And what about schools? We've seen Quebec extend their school break. The Liberals are now calling for an extended school break. We saw the memo yesterday warning students or asking them to bring everything home. Is the government now considering extending the holiday break as we see these numbers rising?
Well, it's always been important to us to keep our schools open because that's really important for students to learn, but for their physical and their mental health. That is really important. However, we are seeing the numbers of cases rise tremendously, and so we're looking at all options, including schools. Yes.
Thank you very much, everyone.
Thank you.